Strokes are accidents that happen in the vasculature of the brain. Let's take a look at this image before we talk about strokes. This is an image from Philips. They're one of the companies that make uh, CTs and MRIs and X ray machines and so on. This is an ad for their machine, but anyway, it's a beautiful image showing some, not all, of the brain vasculature. So, what we're seeing here are blood vessels. A stroke is when any one of these vessels has an event. The events are of two types: hemorrhagic or obstructive. Hemorrhagic, I'm just going to use a large vessel here, is when there's a bleed, when there's a tear, rupture. Now, what would cause a hemorrhagic stroke? Well, a lot of it is bad luck. Having a blood vessel that you were born with that is weak, having angles that are particularly severe. But the main risk factors are the ones that you would imagine: high blood pressure. I fear that high blood pressure is so common that people are starting to not quite appreciate how serious it is. What is high blood pressure? Of course, it's pressure inside your vessels pushing out. The blood is trying to tear through your vessels and come out of your circulatory system. Well, you have uncontrolled high blood pressure. You're just asking for it. You're waiting and waiting for one of these vessels to pop. Other factors are diabetes. Now, diabetes is a blood sugar disorder where the body becomes insensitive to the effects of insulin. Now, insulin takes sugar from the blood into the cells. Now, if you're not responding to insulin, then what's going to happen is sugar is going to build up in your blood. This is diabetes. Now, that state of high blood sugar destroys blood vessels. Diabetes is a blood sugar disease, but it really comes down to blood vessel disease because the pathology is through the destruction, particularly of smaller blood vessels. This is why if someone with diabetes gets they're cutting their toenails and they cut too deep, well, for most of us, your body would send more blood to the toe, healing the damage and fighting any infection that sneaks in. Well, now imagine in diabetes, the small blood vessels are destroyed, particularly in the peripheries, at the very edges of your body. So blood is not able to get to the injured toe. And what happens is infection flares, and this is why so many diabetics have amputations. It's very sad. But the brain is not exempt from this injury from the high state of high blood sugar state. Injury to these vessels is bound to be pathological. Some people, we're going to talk about Alzheimer's in a bit, but some people even think of Alzheimer's disease as type 3 diabetes. Okay? All right. So, obstructive strokes. Obstructive strokes happen when there is a blood clot that blocks one of these vessels. So it's a blockage. Now, some people are just prone to blood clots, but other factors that contribute to blood clotting are high blood pressure, smoking, inactivity, obesity, and diabetes again. People who are quite susceptible to blood clots are people who are very inactive. Imagine if I'm sitting in my chair all day. You got my heart here, trying to pump blood all the way down to my feet and back up and up to my brain and back down and so on. As you sit all day, you see you're creating these 90-degree angles. Well, just like a hose, if you're trying to water your lawn, if you get kinks in it, the flow of water slows down. Now, when blood flow slows down to the legs, you're liable to start developing a blood clot. Blood, when it's just sitting around, tends to congeal. This is why if you cut your finger, you stop bleeding after a bit because your blood clots and stops the flow of blood out of your body. But if this clot is happening inside your vessels, it can build, build, build. Now you have a blockage. Alternatively, a blood clot can begin and then dislodge and travel up and cause a stroke. Drivers, passengers on airplanes are at quite high risk for this kind of phenomenon. But also, typical office workers who sit exceedingly long hours and don't move. Okay, let's talk about some terms. Ischemia is a term for any time that any tissue of the body is deprived of blood. So if a region of your brain is deprived of blood, it's ischemic and it quickly begins to die. Now, a thrombus is a blood clot that forms often, but not always, in your legs. Okay, those are your legs, believe it or not. Okay, so a blood clot forms. That's a thrombus. Now, if a piece of this blood clot breaks off and starts traveling, that's an embolus. So an embolus is the traveling blood clot chunk that broke off of the thrombus. Now, how do you recognize a stroke? Well, you look for face droop. Now, in stroke, generally, you're going to see one-sided face droop. There's going to be just a drop of muscle tone in one side of the body because strokes are almost never bilateral. So they're going to be on one side. Okay, so they're going to affect one side of the body. You want to look for difficulty speaking or understanding language. And you're going to, another quick test you can do is put your arms out in front of you and close your eyes and see if you can maintain the arms at the same place in space. Often with stroke, one of the arms, the affected side, will begin to drop down. Strokes are particularly challenging for doctors because if you're having a hemorrhagic stroke, they need to stop the bleeding with clotting drugs often. But if you're clotting, they need to give you blood thinners to break up the clot. As you can see, if you give one treatment to the other kind of a patient, then you could do significant damage. So your treatment can actually make the stroke situation significantly worse.